Howdy, y'all. In today's Poop Tip Tuesday, we're going to talk about a couple different things. Number one, I'm going to talk about Van Halen and the risk for throat cancer, what you need to know. Number two, I'm going to talk about hepatitis C and the Nobel Prize. I don't know if you saw this or not in the news, but the Nobel Prize recently was awarded to the person who helped out with hepatitis C and what you need to know about that as well. Number three, we'll talk about what it means when your liver enzymes are high and what to do about that. Number four, we're going to talk about IBS. Is it curable? And then number five, we'll talk about what does oil in my poop mean. So for those guys who are joining for the first time, my name is Dr. Islam. And yes, every Tuesday I do a Poop Tip Tuesday where I go on live and also show all the social media channels to give you more information on what you need to know and based on questions that you guys ask me. If you want to have me answer a question live, number one, comment down below and let me know what questions you have. Number two, if you don't want to do it publicly, sign up for my weekly newsletter, or you can shoot me an email and I will see if I can answer that question on a live Poop Tip Tuesday. A couple of ground rules. Number one, I will not answer your particular medical questions. I can't do that, and I do not want to lose my license at all, and I'm sure you don't want to either. And number two, if I don't get to your question, it doesn't mean I haven't seen it. I may have to answer this on a future Poop Tip Tuesday. But guys, I hope you guys are doing well. Hope you guys are having a happy Tuesday. I am sorry I am late. I had another event going on, but I want to thank you for joining me. So let me know in the comments, number one, where are you watching this video at? I'd like to see where my audience is. And number two, are you watching this live or on the replay? Let me know in the comments down below. So you may have seen the news that Eddie Van Halen unfortunately passed away from throat cancer. So what exactly is this? Obviously, this is cancer within the throat area. And the most common symptoms from this typically can be any number of different symptoms. The most common things you have to worry about is whether you have voice changes, chronic cough, maybe difficulty swallowing, and associated other symptoms like weight loss, night sweats, and things like that. Now, not everyone will get throat cancer, and so there's some risk factors you have to be aware about that. If you've noticed in the news in the past couple of years, a lot of rock and roll singers, yes, rock and roll, have been getting throat cancer, and there's a reason for that. Sex, drugs, and rock and roll. That's why you get throat cancer, and those are some of the risk factors you can have that. By sex, I mean HPV. The HPV virus can invade your oral pharynx area and have you at a higher risk of developing throat cancer. Also, alcohol. Alcohol is also a significant risk factor for developing throat cancer. And if you add on that smoking, that is a triple whammy, and that could significantly increase your risk of developing throat cancer. So if you are a smoker who drinks alcohol, who enjoys the rock and roll lifestyle, and are noticing a voice change, chronic cough, difficulty swallowing, don't ignore that. Make sure you get investigation. And I will tell you that if we can find throat cancer early, there is a chance we can remove that cancer and you could potentially be cured. And so I'm a huge Van Halen fan. I've been listening to his music ever since I've heard it back in the 80s, and I'm sad for his passing. He was a great guitarist, but I also want to make sure that we can learn a lesson from what is going on with his passing as well. So I want to thank you for watching. Hello, Amanda. Thank you for watching on today's live video. Mary, good seeing you from Odessa. Michelle, it's good seeing you on your couch. Pam, it's great seeing you as well. Lindsay, good seeing you in Lubbock as well. And thank you guys for watching on the live video. So, question number two, I got it from a patient who said, "Hey, Dr. Islam, I heard on the news that the Nobel Prize was awarded for hepatitis C. What do I need to know about this?" So things have changed dramatically for hepatitis C. So back when I was in med school, we had a whole list of medications that we could use for hepatitis C. All the medications that we used back then sucked. They were terrible. They had very poor success rates. The side effects were bad, with bone issues, feeling like you have the flu all the time, feeling sick, just feeling very, very terrible. And they didn't work very, very well. The success rate was not very good. Had to give yourself a shot, had to get frequent blood checks because your bone marrow went down. It was terrible. Nobody liked it. Now, fast forward. So I've been practicing now for about 7 to 8 years now, and the hepatitis C treatment has changed dramatically. So now we quote cure rates in the 95% and higher. Can you believe that? 95% cure rate when it comes to hepatitis C. You can't get that anywhere in medicine. You can't get that anywhere in life, a 95% cure rate. But not only that, the treatment is so easy and so effective. Typically, it's a couple of pills that you take for maybe 3 to 6 months. That's it. You're done. Very minimal side effects. People respond very effectively, and it works really, really well. So the biggest question people ask me is, okay, Dr. Islam, do I need to be screened for hepatitis C? And I will tell you, yes. If you are of the baby boomer generation, regardless of your risk factors, you need to be screened for hepatitis C. It is a very simple test. All you have to do is get some blood, run it in the lab, and we can check to see if you have the disease or not. If you have it, we'll confirm it, and then based on that, we will discuss whether we can get treatment for you. Now, I will tell you, for the vast majority of people who I treat with hepatitis C, they're cured, they do well, they have no issues, and they don't have to worry about any long-term issues. So, what are the long-term consequences of not treating hepatitis C? A couple things that can happen to you. Number one, you can substantially increase your risk for developing liver cancer. Number two, you can substantially increase your risk for developing end-stage liver disease or cirrhosis. And that in and of itself has complications, including vomiting of blood, having ascites or fluid around your belly, being confused because you can't remove toxins. And also number three, just when people have hepatitis C, you're in chronic inflammation, and that can make you feel bad. You can have joint pain, skin issues, feeling tired all the time. And I've had plenty of patients who've gone through treatment who did not realize the effect that hepatitis C was having on them because that was their normal. And once they got cured and the virus was gone, they felt so much better. And so if you are of the baby boomer generation, yes, you need to be screened. Get a simple blood test. Don't be scared because number one, we can cure you. And number two, the treatment's easy and effective. I don't want you to be ashamed from that, and it's perfectly fine. I'm glad that we can now have good treatment options for our patients who have hepatitis C. All right. Question number two. Hey, Dr. Islam, I really want to improve my gut health. I want to be better for my gut. What can I do to improve my gut? Well, if you've been watching my live videos and my YouTube videos, you know a couple things. Number one, I am the poop guru. And number two, I am the poop whisperer. Yes, I'm going to help you out with your gut. So it is, in my opinion, and for a lot of physicians, that a lot of disease start in the gut. Whether it's actual gut issues, maybe autoimmune issues, maybe it's rheumatological issues, or other issues that are going on. And the more that we can keep our gut healthy and clean, there's a very good chance we can fix other issues going on inside your body, whether you feel inflamed, have joint issues, maybe chronic pain, fatigued, weight issues that actually may stem in the gut. Here is my treatment plan to get you taken care of. Number one, we got to get rid of all the crap. And I'm going to tell you, the crap that you eat is the crap that goes inside your body. So you have to eliminate processed foods. You really do. So goodbye pizzas, goodbye Taco Bell, goodbye roses. You really have to eliminate that. Now I know it's hard because that food is made to taste so good, but there's a reason why. It's got stuff in there it's not good for you, and it makes you addicted to that. So you really have to make it an effort to get rid of that. So number one, get rid of processed food. Number two, my recommendation, I've seen the evidence for this, is to minimize or get rid of red meat. There is a lot of bad effects when it comes to red meat. There's a lot of inflammatory markers that get high. There's changes in your gut microbiome to the point where the junctions inside your gut, which are typically tight, become loose. And you can develop a condition called leaky gut, in which you have these toxins going inside your bloodstream, causing inflammation to occur. We're seeing more and more evidence that red meat tends to do that. Number three is that I would consider for a lot of my patients who have gut issues is to eliminate dairy. Not that dairy is bad, but a lot of people don't realize that they actually can have a lactose intolerant, which can make them feel really, really bad. Number four, I would recommend getting rid of artificial sweeteners, because you may not realize this, but artificial sweeteners can make you feel bad, can ruin your gut, but also more importantly, can make your gut microbiome bad. And number five, the most important thing that you can do, the best predictor for improving your gut health, the best predictor for improving your gut microbiome, the best predictor to improving your everything going on inside your belly is to have a diversity of plants. By far, this is going to be the most important thing that you can do to improve your gut health, to improve your gut microbiome. Forget about all the probiotics you can take. Probiotics cannot fix an unhealthy diet. Forget everything else, all the pills, all the supplements you want to try. A supplement will not fix an unhealthy diet. You need to add into your diet more plants, a variety of plants. Once you do that, you can start to develop a garden inside your gut, and then you can add the probiotics, then you can add the prebiotics, then you can add all the other ingredients to help improve and fertilize what's going on. But without the soil of the plant-based diet, you're not going to make any improvement at all. That is my approach to my patients that I recommend for them to improve their gut health. It's hard. I'm not going to lie. It is a difficult journey to take. I took that journey myself, and I've had a change in my cholesterol from being very, very high to the point where I needed pills to the point now where I don't need anything. And I've improved some of my gut issues as well with that. And this is what I recommend. And I can tell you it works. I've done this on patients. I've done this for myself. This is what I've read the studies. This is going to be the best way to improve your health. Oh, Chip, it's good seeing you. So I've known Chip for a long time. It's great seeing you. Me and him used to do CrossFit. So I don't know if you guys know this or not, but I used to be a CrossFit fiend, and I used to did my training at Mayo Clinic, and me and Chip always did our workouts together. And so yes, thank you for watching, and thank you for watching this video. It's good to hear from you. Perfect. All right. So question number 3 that a patient asked me, said, "Hey, Dr. Islam, I have noticed that my liver enzymes are high. What is going on, and what can I do about this?" If only there was a GI doctor who did a YouTube video on this. Oh, that's me. Yes, I actually have a couple of videos on liver inflammation and what you can do to improve your fatty liver. So I will have you, number 1, go to my YouTube channel, smash like, subscribe, and look for my playlist on liver disease. But a couple reasons. So number 1, the most common reason for liver inflammation is a condition called fatty liver disease. Now, there's 2 main reasons why you can have fat in the liver. Number 1, drinking that alcohol. Alcohol will produce fat in your liver, and over time that can cause inflammation. But number 2 is having a big belly. When you have a big belly, that fat goes into your liver, and over time that can cause inflammation. 2 most common reasons, but also number 3, don't forget about hepatitis C, which I just talked about. And so these are the things that we try to do to help figure out what's going on. Now, when I see somebody who has liver issues, I do a little bit of a workup. I check for a lot of different things. I check for viral problems, so we check for hepatitis. I check for other diseases. We check for autoimmune diseases, and I check for genetic abnormalities as well. I also typically will do imaging of the liver, whether it's an ultrasound, a CAT scan, or an MRI, so I can see how the liver looks. Based on that, I can determine, number 1, the reason for your liver disease, number 2, the stage of your liver disease, and number 3, what we can do to get this taken care of for you. Because sometimes we don't know, based on the numbers alone, how severe the liver damage is. And there are calculators and imaging tests that I can use, allows me to see that. Now, if the most common reason for fatty liver disease is either fat in the liver from alcohol or fat from around your belly, couple things I recommend. Number 1, obviously, if you can stop drinking alcohol and minimize this, there's a very good chance your liver numbers will improve. Number 2, black coffee, without all the good stuff, without the cream, without the sugar, has been shown in clinical trials to decrease inflammation. The recommendation can range from 2 to 4 drinks of black coffee per day. It does not have to be caffeinated. It can be decaf, perfectly fine. And number 3, there are about 6 or 7 foods that I recommend eliminating. Things like pizzas, pastas, tortillas. These are the foods that have a lot of fat, a lot of carbohydrates that are not good for your liver as well. But once again, I have a couple of videos on what I recommend to help out with your liver disease. What I want you to know is that your liver is a beautiful organ in the sense that even if it's damaged, there is a chance, a good chance, that you can reverse the damage and make it normal again. The issue with your liver, though, is that it can be damaged for a long time and you not even realize it until it's too late. And by the time you have symptoms, yellowing of the skin, itchy skin, having dark splotches, just not feeling very, very good, that may be a point in time where we've already crossed that bridge and we can't get it back to normal again. So if you're worried about your liver, simple blood tests can check to see what's going on. Anybody can do that. And if you have issues, come find me or watch my videos on that. So thank you guys for it's a very good question. Veronica, good seeing you as well. Hi to you. Thank you for watching on today's video. All right, perfect. So question number 4, Dr. Islam, I got IBS. Is it curable? This is a very difficult question to answer. So I will tell you this. The mantra within the GI world is that IBS typically is not a curable condition. And to be frank with you, that can be very hard for some patients, but it is the truth because there's no cure that I can give you. Unlike, let's say, diabetes, where essentially you can be cured if you lose weight and exercise, IBS tends to be a chronic condition that tends to be there for the rest of your life. And I try to tell this to my patients. This does not mean that you have to suffer for the rest of your life. But I will tell you that anyone who tells you they've cured your IBS or got their IBS cured, they're lying, because you can't cure it, but we can manage the symptoms to the point where it does not affect your life. And there is a protocol that we typically recommend, and usually it's based on symptoms. So if bloating is your most important symptom, we have treatments for that. If pain is your most predominant symptom, we have treatment for that. If it's constipation, treatment for that. Diarrhea, treatment for that. Mixed pattern, treatment for that as well. And so we have effective options to help treat IBS. But I will tell you, if you're expecting a cure, that is very difficult to do. But having said that as well, it does not mean that you have to suffer from this condition. We have very effective options, both medically and naturally and diet-wise, to help out. And my approach is try to give you the options that are there. So for my patients who come to see me for their gut issues, I tell them we can try dietary therapy, we can try a natural approach, or we can try the medical approach. I am fine doing any approach that you want. I have some patients who say, hey, Dr. Islam, I just want a pill and get better. Perfectly fine. I am here because I'm trained for that. I have other people who tell me, hey, Dr. Islam, I want to try a natural approach. Not a problem. I'll give you my recommendations for that as well. We can use a combination of all the above, or maybe try different things. I want to work with my patients. And I try to tell them, hey, some things may or may not work. It's kind of hit or miss, but we will try and see what we can do to get your gut taken care of. And so that's my approach when I have patients who have IBS, but it's not, unfortunately, curable. All right. Question number 5. Great question. So, Dr. Islam, I notice that I have oil in my stool. What the heck is going on? All right. So, how many of you guys out there, I don't know if you're going to actually raise your hands, have actually noticed oil in your stool, kind of a film on there where it's hard to flush and it kind of sticks to the toilet bowl? I know, I can't believe I'm talking about oil in your poop on an actual video, but this is a real condition. It's called steadiria. It's actually is whenever you have fat in your stool. This is a very common reason for us to have diarrhea. Now, there are a number of different reasons why you can have fat in the stool. For some people, your pancreas may not produce enough enzymes to get rid of that fat or metabolize it, so you actually end up secreting it in your stool. That's why you see that oil that's there. Number 2 is that there are certain bacterial conditions like small intestinal bacterial overgrowth that can make it less likely for you to get rid of fat or to reabsorb fat. You can have that inside your stool as well. And there are other conditions as well that are a little bit more rare, which makes it less likely for you to have more likely for you to have oil in your stool. So if we see this, this is nothing to be alarmed about, but this gives me a clinical clue for what we can do for treatment. So let's say, for example, somebody sees me and says, hey, Dr. Islam, I noticed that there's oil in my stool. Well, this makes you think, do I need to try some sort of prescribed pancreatic enzyme replacement to help out with that? Now, it's important that it's prescribed because some of the digestive enzymes you may be getting over the counter are not high enough or specific enough to give you enough what's called lipase, which is an enzyme to help metabolize fat inside your pancreas. And that may be a lot less than what we can get prescribed wise. Or I may test you for a condition called small intestinal bacterial overgrowth. Or I may do other testing to see if I can determine exactly how much fat is in there or not. Because the treatment for fat in the stool can be very different from treatment for somebody who has just regular old diarrhea or gut issues as well. And so I want to try and see if I can specify the reason why you're having fat in your stool. But this can be a very normal thing to have. And most people notice kind of a film on there, difficult to flush, maybe some stool sticking on the sides of the toilet bowl. All right, Joe, it's good seeing you. Thank you for watching on today's video, and I appreciate you watching live. All right, perfect, guys. These are great questions, and I appreciate you asking these questions on my video right now. So, if there's no more questions, a couple things I want to let you know. Number 1, if you haven't already, don't forget to smash that like button, like, share, subscribe. This will help all the social media people and all the giants out there. Facebook, YouTube, LinkedIn, Instagram, all that. Let them know that actually somebody's watching my videos. And number 2, if you haven't already, if you can subscribe to my weekly newsletter, that way you can ask me a question. I can collect those and hopefully answer those on a future live video as well. So Andrew, Andrew, sir, hey, it's good seeing you. So any thoughts on vasculitis and its effect on your GI tract? So the answer is yes. There are conditions that we think that can be related to vasculitis or inflammation of some of the blood vessels and your gut issue. We know there are conditions that can overlap with that. We know there's conditions that can start in the gut and manifest as that as well. We also know that the gut microbiome may play a role when it comes to vasculitis as well. And for some people, once we can change what's going on inside their gut and change their diet, this may improve the inflammation. And so we don't have a lot of good evidence for this, but my theory is that a meat-based diet produces inflammation, and that for some people that can cause inflammation to go into some of the blood vessels, leading to vasculitis. So these are my thoughts, and we're seeing more and more evidence of that being a significant role when it comes to your health. And once again, I am a proponent of trying to do as much as you can of a plant-based diet to hopefully help out what's going on inside your gut. Great question as well. Mr. Kelly, Sean Kelly, it's good seeing you. Thank you for watching on today's live video. All right, guys. Any other questions? If not, I appreciate you guys watching on today's Poop Tip Tuesday. I look forward to hopefully seeing you guys next Tuesday. And if you haven't already, please smash that like button. Like, share, and subscribe. Hope you guys have a happy and healthy day. Take care, everyone. Thank you so much for watching.